It was in March 2020, during peak COVID-19 pandemic hysteria, that the general population was told to lock down and shelter in place to save our grandparents. But it turns out that trusting the experts to adequately protect the elderly from a respiratory virus left them vulnerable to neglect and systemic mismanagement. And I have the government documents to share with you that prove it. Tamara Ugolini here with Rebel News, bringing you a much-awaited and filibustered update on Pinecrest Nursing Home in Bobcaygeon, Ontario. It was the first long-term care home in the province to be declared on a COVID-19 outbreak, which facilitated media frenzy and framed COVID, not systemic mismanagement, as a ravenous grandparent killer. And if you questioned that narrative, you were coined as a selfish grandma killer. Remember the extreme social media shaming that unfurled relentlessly with neighbors started tattling on neighbors and people called police on kids playing in parks? Yet these measures never protected our grandparents, and they remained vulnerable and at risk. And I have been investigating this particular incident since the fall of 2020. At that time, I filed an Access to Information request, which has been filibustered ever since. And we're able to keep digging and keep filing and appealing thanks to your support and generous donations at rebelinvestigates.com. Because originally the Ministry of Long-Term Care tried to tell me in April of 2021, after months of back and forth, that no responsive records existed for my inquiry. But my communication with the home directly proved otherwise. They had daily communication with various health system partners, and they just hit me with 14 PDFs and 100 pages worth of documentation. So how's that for no responsive records? It took appeals and following up, repeated requests for clarification to get to where we are now, and I finally have the documents to share. But first, let's do a quick recap. It was in the spring of 2020 when my colleague David Menzies first went to visit Pinecrest, when the terrified and sniffling staff stopped showing up for their shifts and the home became severely understaffed. They also faced a shortage of PPE, personal protective equipment, thanks to the repeated failures of Theresa Tam's Public Health Agency of Canada, who sent 16 tons of our PPE to China in February, a month before pandemic pandemonium broke out in Canada, leaving staff, such as those at Pinecrest, scrambling without masks or gowns. It was at that point that the local health unit got involved. At the time, Lynn Noseworthy was the local medical officer of health for the Halliburton, Kawartha, Pine Ridge District Health Unit, also called HKPR. Of note, she received a 32.6% raise in 2020 for a yearly salary of $406,000, arguably due in part to some of the overtime clocked, which was necessary to address the situation at Pinecrest. But it was too little too late. In the 2.5 weeks that ensued after the outbreak was declared on March 20th, the home lost nearly half of its 65 residents, and COVID was blamed. After all, as reported by the now disbanded Ontario Science Table, 81% of COVID-related deaths during the first wave of COVID-19 in Canada were in long-term care homes. 81%. This was utilized to institute mass hysteria and was used to justify further lockdowns, mandates, and restrictions that we now know have caused massive societal, economic, and health harms. However, these Access to Information documents show that deaths were a result of panic, ill-preparedness, and an impossible to navigate bureaucracy, not necessarily a respiratory infection. One day after the outbreak was declared on March 21st, Noseworthy sends an email to the Emergency Operations Center of the Ministry of Health with the subject, "Emergency request for assistance with staffing and PPE for our nursing home outbreak," and flags the importance as high. It notes that there are 14 staff members who are symptomatic and off work, self-isolating at home, and further that the nursing home is severely understaffed due to the high attack rate within resident and staff populations and has a significant shortage of PPE, noting that there is a concern over the emergency situation. Noseworthy then asks how to expedite appropriate staffing, support, and PPE supplies. An email from David Lamb on March 23rd shows that the ministry was scrambling, trying to get college students to jump in and assist. Have a look. Can you put together a list of the homes, i.e. nursing homes with staffing issues, plus the colleges closest to them? I think we have to consider seeing if we can get some learners in there, maybe. The next day, on March 24th, which is 4 days after the outbreak was declared, Noseworthy sends an email to Sarah Levitt and Barbara Yaffe asking for help. She says, "I understand the critical staffing issue was bumped up to the regional table for discussion yesterday and wonders if they were able to mobilize any staff to support the nursing home." She then asks if ill staff with resolved symptoms can return back to work as long as they wear appropriate PPE and provide care only to ill residents, saying that they don't have time to wait for the results of 2 specimens taken 24 hours apart for those staff whose symptoms have resolved. This shows the absolute absurdity and devastating harms caused by senseless COVID testing policies as early as March 2020 that arguably still persist in various sectors today across the province and across the country. The same day, Sarah Levitt from the Ministry of Health responds to Noseworthy saying that we have provided the home with a contact at the RNAO, the Registered Nurses Association, who is going to support with nursing resources. Yet by the afternoon, Noseworthy sends another email saying that the nursing home is desperate for staff and has now contacted the local municipality to see if their communication services can go public to look for volunteers to help them, before asking, is an EMAT, that's an emergency medical assistance team, not an option? She then resends that email with the priority flag less than an hour later. The next day, on March 25th, Noseworthy again emails the Ministry of Long-Term Care, this time directed to Stacey Colomecco, who is supposed to be the Director of Long-Term Care Inspections, saying that Pinecrest is still understaffed and has been unsuccessful in getting staffing assistance, noting that resident care is being adversely affected and that the Mayor has requested that the health unit send public health inspectors to investigate. Colomecco responds with the first part redacted under Section 21, which pertains to personal privacy, but says, "We're in the process of setting up an urgent call to discuss possible solutions. We have been escalating everywhere for days." The next day, March 26th, a full week almost since the outbreak was first declared, Catherine Brown emails asking the Ministry of Long-Term Care to intervene and take immediate action to stabilize the home so the residents can continue to be cared for in place. She notes that there is difficulty reaching anyone who is in a decision-making position at Pinecrest and that the owner is not responding, seemingly MIA, missing in action. HKPR then issues a media release on March 26th, and it quotes Dr. Noseworthy as saying, "This outbreak of COVID-19 is currently the largest outbreak in the province and really brings home how devastating and deadly this virus can be for older people in our communities. They blame COVID, not mismanagement. And while the bureaucrats are scrambling, frail elderly residents are dying." Let's look at one of the recap summaries detailed in the Access to Information documents. On March 18th, the respiratory outbreak was first identified and confirmed 3 positives. A new admission from Toronto on March 10th is said to be the source of the infection. They were asymptomatic upon admission and shortly after became symptomatic. This was the first resident to have a confirmed positive COVID test on March 17th. It wasn't until 3 days later that an outbreak was confirmed and declared to the Ministry of Long-Term Care on March 20th. Sometime between March 24th and 25th, deaths began. On March 25th, the home reported 2 resident deaths. They were apparently symptomatic but not tested on the direction from the public health unit. It's a provincial policy applied in flu outbreaks that stipulates if there are 3 positives, then everyone with symptoms thereafter is presumed to have the same virus. The home says that residents with symptoms are deteriorating quickly, and they only had 4 PSWs to start the evening shift, and staff are available for the night shift. That seems like a very vague term, staff. But nonetheless, doesn't it seem oddly coincidental that nurse Sarah Gardner from Pinecrest previously told media that nobody showed up for the 3 p.m. to 11 p.m. shift on Monday, March 23rd, and then the death count began ticking? So back to this summary. On March 26th, private for-profit Extendicare Assist was asked to provide management support to Pinecrest. They were to provide the home with infection prevention and control expertise and develop staffing plans. And email communications from April 9th show that the ministry didn't even have a management contract in place with Extendicare. There was apparently no time, and instead they finalized a process that named Extendicare as a vendor of record as a management company for long-term care homes that encounter issues. Which is a bit odd because while discussing details on April 2nd, Brian Pollard, the Assistant Deputy Manager of Long-Term Care Operations Division, already knew that this would happen when he says that Pinecrest is a significant risk point for the ministry. He says that the ministry triggered an existing contract with Extendicare Assist to support homes that they've effectively taken over, which is what they're doing with Pinecrest. And there is usually a $2 million budget in the long-term care line to pay for it. And then they discuss contracts with Craig Eaton from Compass Canada for a meal delivery service at the home. But going back to when Extendicare was first brought in, the next day, March 27th, it is reported that there are no staff shortages and staffing is stable. Yet the following day, on March 28th, the carnage continues with 3 COVID-related deaths being reported by the home. And every day from March 29th to April 4th, when the summaries suddenly stop, there's at least 1 resident death, but more often 2 or 3 every day. Yet only those initial 3 confirmed positives were ever tested from weeks prior. It wasn't until April 1st that the Public Health Unit, HKPR, stepped in and tested 32 residents. And unbelievably, it wasn't until April 3rd that symptomatic residents were cohorted to one side of the building with designated staff. And according to the emails enclosed, the outbreak was not declared over by the health unit until May 14th, 2020. But there's barely any information included in the documents from when Extendicare took over on March 25th and onward. It looks like Noseworthy was trying to follow the science around COVID testing when the outbreak was declared over. Look at this. In many cases, residual genetic material can continue to persist in the nasopharyngeal cavity for quite some time, which is proving to be very problematic in many circumstances. The presence of the virus does not equate to communicability. Yet the local hospital, Ross Memorial, whose role throughout the management of the COVID crisis in this home is unclear throughout the rest of the documents, chimes in on May 15th, asking for the outbreak status to be reinstated due to continued concerns not captured within the Infection Prevention and Control Report. We now know that by the end of April 2020, Premier of Ontario Doug Ford called in the Canadian military to address the dire concerns, just like that of Pinecrest, and their report detailed horrific instances of malnutrition, neglect, filthy living conditions, and bug infestations. In one home, 26 residents died as a result of dehydration prior to the arrival of military due to lack of staff to care for them. They died when all they needed was water and a wipe down. So is this what really happened at Pinecrest? It was the first long-term care home to be hit with a COVID-19 outbreak, and mass casualties ensued as people were terrified. There was poor infection control practices because the home was filled to the brim with communal living situations. There was a delayed response to the outbreak, an obvious lack of transparency with no records existing, and worsening staff shortages as terror was instilled into the general population about an inflated infection fatality rate based on faulty modeling. For Rebel News, I'm Tamara Ugolini. If you appreciate this work and want to help support our investigative journalism, you can do so at rebelinvestigates.com. At that website, you can check out all of our previous reports and all of our exclusives. That website, again, is rebelinvestigates.com.